Have you ever wondered about the differences between total intravenous anesthesia, or TIVA, and Sevoflurane Inhalational Anesthesia? These are two common methods used in the world of anesthesiology, each with a unique set of pros and cons. Dive into the universe of TIVA first. This is an anesthesia technique that provides a stable depth of anesthesia, reducing the risk of intraoperative awareness and ensuring a smoother recovery with fewer side effects. TIVA also minimizes respiratory depression, which makes it an attractive choice for patients with compromised respiratory function. However, TIVA is not without its drawbacks. It can be more expensive due to the cost of intravenous drugs and monitoring equipment, and it requires a complex setup with continuous infusion pumps. This technique might also be less familiar to some anesthesiologists, leading to variability in practice. Additionally, there's a risk of drug accumulation in prolonged surgeries, and a slightly increased risk of infection due to the use of indwelling catheters. Now, shift the spotlight to Sevoflurane Inhalational Anesthesia. This method is known for its rapid onset and offset, providing efficient control of anesthesia depth. Sevoflurane is highly versatile, suitable for a wide range of surgical procedures and patient populations. It undergoes minimal metabolism, reducing the risk of organ toxicity. Additionally, it is less invasive as it does not require intravenous access, and it's relatively straightforward to administer. Nevertheless, Sevoflurane also has its disadvantages. It can cause respiratory depression, particularly in susceptible patients. It contributes to greenhouse gas emissions when metabolized, and in some cases, it may irritate the airways, leading to coughing or bronchospasm. While rare, Sevoflurane can trigger malignant hypothermia in susceptible individuals. And last but not least, its characteristic odor may be unpleasant to some patients. In conclusion, both TIVA and Sevoflurane inhalational anesthesia have their advantages and disadvantages. TIVA offers precise control over the depth of anesthesia and reduced risk of awareness, but it can be more expensive and complex to administer. On the other hand, Sevoflurane is versatile and easy to administer, but it can cause respiratory depression and has an environmental impact. The choice between these two largely depends on the specific circumstances of the surgery and the patient's health condition. As always, the best decision is made in consultation with a knowledgeable anesthesiologist.